1320 WILS Morning Wake Up.
You know, there's one issue here, as we've been covering the COVID pandemic here the last 2 years, and if there's one issue related to COVID that I think gets overlooked a lot of time, I think it's mental health. A lot of people struggling psychologically, and not that it's never been discussed, but sometimes it gets lost in the shuffle. And what's happening here these days with the mental health crisis, especially among teenagers, young people, it's definitely been a problem, and we're going to talk a little bit about that right now with Dr. Dean Beckloff. He is a licensed professional counselor, and he joins us now on the other end of our line. Good morning, doctor. How are you?
Good morning. I'm doing well. Thank you. It's a pleasure to be here.
Yeah, it's great to have you with us as well. So just give us your take here the last 2 years, first off. What have you seen in terms of teenagers and mental health, and just how have things been different over the last 2 years than in previous years, as we've been dealing with COVID here?
Right, yeah. Well, we've seen an amazing jump in calls from parents about their teens and about their teens' depression or anxiety, and those things going through the roof. And we've just been struggling and getting stressed just to try to keep up with the calls.
Yeah.
And that seems to be the what's happening all over the nation. And we've seen a rise of kids being taken to the emergency room for not only depression, but they're looking at suicide or self-harm. So, and those numbers have been rising too. So we know that that's happening, and and this started happening before COVID.
Okay.
Now, certainly COVID, I think, has made a big increase in this as well.
Sure.
But and not just COVID. I mean, we were shut down and kids weren't going to school.
Right.
So lots of things changed for us.
It definitely did. Prior to COVID, like you said, public health has been an issue for who knows how long. But what were some other issues? What were some other factors that have led to teenagers having some problems mentally, aside from public health? Pre-COVID, as far as non-COVID related matters prior to 2020,
right.
What did we hear of a lot back then that maybe we're not hearing a lot about right now, if you see where I'm going with that?
Well, I'm not a great deal of research has been done in terms of trying to figure out what's going on. So we're all left to conjecture what's going on and why the rise. And the rise has been a 60% increase. So it's been an amazing increase that we've seen over the years. I think that you and I can conjecture about a number of things. I mean, when I was a kid, we had 3 channels, and what is it now? Thousands, maybe?
Right.
I don't know.
Right.
And so our world has changed, our social world. The electronics have certainly made an impact, in my opinion, and especially with social media.
Yep.
We're seeing lots of factors going into this, I believe, notwithstanding that teenagers are a bit vulnerable anyway because they're growing so rapidly, including their brain. The brain is really in overdrive as they're trying to grow up.
We're talking with Dr. Dean Beckloff, licensed professional counselor, has extensive experience working with children and teens dealing with depression. You mentioned the phrase self-harm earlier. How do counselors, how do psychologists and people within the mental health profession, I mean, what kind of steps do you take to go about, talking a young person out of harming his or herself, or even, God forbid, taking his or her own life?
Right.
How do you approach that issue, and how do you go around to telling the youngsters, hey, it's going to be okay, it's going to be a struggle, but you'll come out on top at the end.
Well, that right there is very good. What you just said, is encouragement, affirmation, giving them some education. Education is part of it too. We call it psychoeducational, but there's an educational aspect of teaching the teen other ways of managing their pain and their depression or their anxiety, that there are other things that they can do that are healthy and not harmful. When I was in high school, there was no such thing as self-harming. It just didn't. I don't ever remember hearing about it.
Yeah.
But now everybody's heard about it. So there is just, access to information that people then begin thinking about it, and teens do. Mm-hmm. And teens don't have the maturity. We use a lot of folks, the parents. We work with a lot of parents on working with their teen as well. So parents are a big part of helping that particular area.
Yeah. That's a great point right there. And yeah, I think back in my time growing up here, as far as self-harm goes, I wouldn't say that in my world it was non-existent, but it was rare. Definitely rare. If you see what I mean there. And Doctor, before we let you go, this kind of this so-called mental health crisis. Is these issues that teens are dealing with here? Just kind of asking you here on the broad scale. Do you see? I don't know. Do you see an increase in mental health problems? Looking ahead here long term, is there maybe not necessarily a magic wand, but are there any fixes to get people on the right track mentally? What do you think when you look ahead at the months and maybe more importantly years ahead?
My hope, and I think this is going to be true for most mental health professionals, is we can see a light at the end of the tunnel. We're trying to understand what's going on, and then obviously there's a lot of things that nobody can control, like electronics and all the new things that keep coming. But I think we're understanding it better, and therefore I see a positive hope as we move forward into this world that we live in.
Yeah, let's hope so, definitely. Dr. Dean Beckloff, licensed professional counselor, extensive experience with children and teens dealing with depression, and definitely a discussion here of mental health that I would hope just continues here as we go over time, especially during this time of COVID, where a lot of unprecedented situations have occurred. Doctor, thanks so much for joining us this morning.
Thank you.